Hello everyone, welcome to our channel Paramedical Stream. Myself Vandana. Today our topic is about sign, symptom and treatment of a heart attack. In previous class we have discussed about the erythrosclerosis and what is a myocardial infarction and ischemia. The blocking of a coronary artery by a plaque or a fat tissue is the erythrosclerosis, and damage of a coronary artery is a myocardial ischemia. And due to the damage of the coronary artery, there is no blood supply for the myocardium at that point. So that is called, due to the tissue damage of a myocardium is a myocardial infarction or heart attack. And now what are the signs of a myocardium heart attack is there is a chest pain. The chest pain, it may travel to the jaw and to the left arm, and it may go to the stomach and abdomen, and the patient may feel and the person may feel dizziness, fatigue and headache. He may shiver and there may be a sweat. So these are some symptoms of a heart attack. What are the treatments? We have many treatments for the heart attack. We can give by medications. What are the medications we can give to the patient is we can give a vasodilators like aspirin, which make the free flow of blood in the artery, and we'll give the beta blockers. Beta blockers reduce the heart rate and decrease the BP, decrease the blood pressure. And so what are by medications we can give the vasodilators like aspirin, which make the free flow of blood in an artery. And second, we can give the beta blockers. Beta blockers reduce the heart rate and blood pressure. Now what is the another treatment is we can give the CPR. CPR is the cardiopulmonary resuscitation. It is given to the person when there is a sudden cardiac stroke or a heart attack. And fourth, we can have the defibrillation technique. Defibrillation technique, we will use a defibrillator to give the electrical impulses for the SA node, which starts sending impulses to the heart, and it starts a heartbeat. And next we have if surgeries, when we go to the surgeries, we'll have a coronary artery angioplasty. Coronary artery angioplasty. So what is coronary artery angioplasty is in a damaged coronary artery, we'll insert a balloon like a catheter, and we'll make the we'll blow the air in the balloon so that the balloon widens and there is a free flow of a blood. If this is a coronary artery, we have a coronary artery, and we have a plaque here. So due to the formation of a plaque, there is no free flow of a blood here. So there is no free flow of a blood from here. Here the blood is stopped. Now this is a catheter, air balloon catheter. We'll insert this in this place. When we insert the catheter in this place, and we have to blow the air inside the catheter after the entry of catheter in the blockage area. Now what happened? This is the artery, and now this catheter is thin. When we blow the air, the catheter widens. Now the catheter widened. Now there is a free flow of blood in the artery. Normally what we will say, we say that we have a stent in our heart. So this is the stent. the stent is this will be like a thin mesh. So, and due to the when we insert a catheter, it widens and there is a free flow of a blood. So this is a one method.
Here we can observe the coronary arteries in the heart, where the coronary arteries is damaged by formation of a plaque. In the coronary artery, we can observe that there is a blockage of a free flow of a blood by plaque, which can be prevented by a coronary artery angioplasty. Now here in the angioplasty method, we can use a radial artery and a femoral artery. In a radial artery, insert a needle and insert a guide wire from a needle. Now needle is removed and insert a tube through a guide wire. Through this tube, insert a guide wire until it reaches the aorta. Here we can observe that there is a passage of a guide wire from the radial artery up to the aorta and insert a catheter through this guide wire. Now we can observe that there is a catheter and a guide wire in the aorta. Now we can observe the blockage by using the fluoroscope. Now at the plague position, insert a guide wire and insert a catheter, air blown catheter. Now air is blown inside the catheter so that the balloon gets widened and it makes the artery widen. Now the balloon is deflated and remove the catheter. Now in the place of a plague, we have to insert a stent which is a thin mesh like a metal. It is inserted in the place of a plague by using a guide wire. Inflate air so that the stent become widened and again deflate the catheter and remove the catheter and remove the guide wire from the position. Now we can observe the free flow of a blood through the stent without any blockage by a plaque.
Disease. And we have another surgery which is a cabbage or a coronary artery, which is a cabbage coronary artery bypass, coronary artery bypass graft surgery. So what we'll do in this surgery is we'll take a vein, syphilis vein from our leg, and we directly insert from the artery to the aorta to the damaged area. Now here if we take if this is a heart and here we have a aorta, if this is a myocardium, this is the outside of the heart, if here we have a damage, so there is a, due to the damage there is no supply of blood to the heart in this area. So what we'll do in this, now we'll insert a vein. This is a vein which is a syphilis vein. Syphilis vein which is taken from our leg. Now this vein directly inserted from the aorta. Here we have to join here to the aorta and from aorta to the damaged area. Now the blood flow from here to the damaged area. So due to again after some days it will treat. Due to the supply of blood to the damaged area, now the myocardium gets good, and by this method we can clear the tissue damage.
Here we can observe the joining of syphilis vein from aorta to the damaged coronary artery so that it can get the free flow of a blood.
These are the treatments which we will do for the heart attack. And before treatment, prevention is better than cure. So what we have to prevent, take less salt, do exercise, and take less oil so that there is no formation of a cholesterol in the artery, and less sugar. So to avoid the salt, sugar and fat substance. So this may help in the prevention of the heart diseases. And this is about the heart attack. about a new topic. And please like, share and subscribe to our channel Paramedical Stream, and click the bell icon for upcoming notifications. If you have any doubts and if you want to know anything more, let me know in the comment section. And thank you.